much in touch with the Drug Control of India and the other powers that be, and they've assured us that they will maybe by the end of this week or next week for sure license us. The licensing of the vaccine made by Serum Institute of India should be far away, maybe a few days from today. And we've got 70 million doses now ready and licensed, tested the National Control Laboratory, ready for release whenever the drug controller gives us the necessary official approval. My main problem is the Health Ministry has still not given us a firm order or commitment to buy not even 10 or 20 million doses as of now. So the first question I asked is, when is that order going to be placed, and what will be the states or cities that they would like us to deliver the vaccine? But I don't think it's out of the reach of the Health Ministry and the Government of India. They haven't given us a firm commitment, so I don't want to go on air and make a commitment which is not in our hands.
Well, that is Serum Institute Cyrus Poonawalla saying that they are ready to distribute the vaccine as soon as they get the approval from the Indian drug regulator, but also pointing out that so far there is no firm commitment. There is neither an advance purchase agreement or a purchase agreement that has been signed with the Indian government. Well, to take the conversation on vaccines as well as the outlook for India's healthcare industry forward, we're now joined by Abhay Soy, the Chairman and Managing Director at Max Healthcare, Viren Shetty, the Executive Director and Group CEO at Narayana Health, and Dr. Sudarshan Balal, the Chairman of the Medical Advisory Board at Manipal Hospitals. Gentlemen, appreciate you joining us here on CNBC TV 18. Well, through this year, the focus has been on healthcare workers, on hospitals, and so we thought we might as well end the year there as well. Abhay Soy, let me start by asking you about the vaccination program that the government hopes to roll out at some point in January. That's the indication at this point. Now, the phase one prioritizes healthcare workers. Have you heard from the government? Have they taken data from private providers like yourselves in terms of the number of healthcare workers that may require the vaccination given the age criteria, etc.?
So all the states, which is 6 that we are present, the state governments have taken data, comprehensive data with respect to all healthcare workers, the age and so on and so forth. The statistics, and we provided it. This happened a couple of weeks ago. We've also, in certain states like Delhi, the government sought, and we provided them with the number of volunteers we will provide for inoculation programs in the interiors as well. So yes, there has been an exchange of data, but we are yet to hear back from them when they are and how they are planning to proceed with the inoculation.
Okay, so there has been an exchange of data on the healthcare workers who are working within your hospital chains across 6 states. But you also talked about volunteering your services for the inoculation program. You said, for instance, the government of Delhi has sought information from you. Can you take us through how many volunteers across different states you would be able to set aside as far as the inoculation program is concerned? How many vaccinators, for instance, do you believe that Max could provide to the government across different states?
Well, quite a few, not only, because we've got close to about 600 phlebotomists. We have, about 4,500 senior clinicians on our rolls. We've got about 11 to 12,000 nurses across 6 states. But other than that, we are also, we are in touch with GPs, close to about 10 or 11,000 GPs. And as you will be aware, in a place like UK, the GPs are the ones who are giving out the shots. So we'd be able to train the staff, and these sort of training programs have already been taking place. We have been training, we've been going through internal protocols, because when the time comes, how do we kind of rise to the occasion? And I think there will be several thousand people that we can put out actually.
Okay, that's good to hear. But as you point out, you still haven't heard back from any of those state governments so far. Viren Shetty, same question to you. Has there been an exchange of data with various governments? And what do you believe the private sector can do in terms of aiding the government's vaccination program?
Yeah, the government has approached us and we've given them the list of all the healthcare workers, similar to the point that Abhay made. And to the question you asked about what can the private sector do? Literally anything. If they want us to give up our facilities for using it as storage facilities, we would do that. If they want us to send our doctors into rural villages to do inoculations, we would do that. We're here to help, but we haven't been approached. And so in the end, it's just a question of the government deciding what it is that they really want from the private healthcare sector. Nothing has been communicated to us, and it's likely that maybe we're not a part of that, and that is fair as well, because the public healthcare facilities are far vaster and much more spread out across the country than private hospitals. So maybe that makes more sense.
Yes, that might be the case as well. Dr. Balal, let me get you to weigh in on this as well before we talk about the outlook for 2021. Any information from the government on whether they would like your support as far as the inoculation drive is concerned?
I think the dialogues have been somewhat similar to what Viren and Abhay have said. They have certainly taken the list of all the healthcare workers. They have sort of entered into a dialogue with us to find out how many vaccinators we would be able to provide, whether we would be able to do it in different facilities. And obviously, the private sector is quite large, provides most of the healthcare in this country. And I do believe that this should be a public-private partnership. Otherwise, it would be impossible to vaccinate 1.4 billion people. And we are willing to provide any kind of support. But I do believe that in the initial stages, this will be tightly controlled by the government because there would be a shortage of vaccines and they have to prioritize and they will have to have some form of control. But we are willing to contribute in any which way that's possible.
Yes, we are still awaiting details from the government on what the process is likely to be, both in terms of procurement as well as distribution. But Abhay Soy, let me come back to you now and ask you about procurement, because we were speaking with Cyrus Poonawalla, the chairman of Serum Institute, as well as the principal scientific advisor to the government of India, Mr. Vijay Raghavan. And the indication was that the vaccine should be available for private use and available in the market perhaps closer to February or March. Now, is this going to be something, for instance, Max Healthcare will prioritize? Will you look at procuring, whether it's the Oxford AstraZeneca serum vaccine or any other vaccine, to be able to inoculate your own people? Is that something that you're looking at this point in time?
Well, certainly. I think, the health of our healthcare workers, their safety is paramount as far as we're concerned. And, if the government makes it available, well and good. But otherwise, we would proceed with the vaccination drive ourselves. And of course, subject to availability of the vaccine. Presently, all across the world, as well as in India, I believe it is going to be canalized via the government. So the procurement is going to be would happen through the government rather than the manufacturers themselves, because, I'm not aware or familiar with any, private sector players, hospitals or otherwise being able to purchase it from manufacturers or distributors of the vaccines worldwide, whether it's Moderna or Pfizer, any other country as well, because I think most of the production has been spoken for by various governments, and I believe Pfizer was on record as well that they'll entertain government only. So, as and when it happens, if the government makes it available to us, of course, I think, we would be more than happy to procure it, not only for our own healthcare workers, but, even for our patients. 70% of our patients are repeat patients, and, a lot of them are vulnerable.
Absolutely, but you're right in pointing out that so far the procurement is being driven by governments across the world and in India as well. As we point out, there is currently no purchase agreement signed by the Indian government with any vaccine manufacturer, and the first one likely to get the regulatory approval will be the Oxford AstraZeneca vaccine that is being manufactured by Serum Institute here in India. But Viren, let's talk a little bit about life post-COVID now, and the good news is that for the 33rd day in a row, we've seen the number of active cases declining, the number of additions bordering around that 20,000 mark on a daily basis. What is the situation like as far as hospitals like yours are concerned? And more importantly, are you now looking at reallocating provisions that were made for COVID to non-COVID facilities, to non-COVID beds?
The reallocation happened months ago. What's happened is that the average daily case count has come down across all the hospitals, but the severe cases, The cases that required ICU care, the cases that required hospitalization and oxygenation have been going down steadily for months. And so the reallocation did happen, but we are absolutely not out of the woods yet, just by virtue of the fact that there is a new variant now and there are movement restrictions, so we can't expect a move back to normalcy. I've been telling everyone that works in our company that COVID is going to be a part of our lives for the foreseeable future, and to plan for an always-on pandemic situation, which means there will be some elements of what happened in the years past that would be true, and there'll be some parts that will always require protection, PPE, all the precautions, and some amount of vaccination, keeping some capacity for COVID. And I think that's going to be the future for all healthcare groups going forward.
Dr. Balal, if that is in fact going to have to be the way that healthcare service providers like yours function, what should we now expect in terms of 2021? The kind of pressure, the kind of crisis that we witnessed in the last few months, that pressure has now abated because we've seen a decline in cases. But as Viren was right to point out, we have to be on guard, especially with the fact that we've got now this UK strain, a South African strain that could perhaps add pressure on infrastructure as we've seen global. But what does the outlook now look like in terms of 2021? How are you planning your resources?
Truly, it's been an extraordinarily challenging year like none other that I've seen in the last 5 decades of a medical practice. We have been badly bruised and battered, and we are coming out of it. However, there is some concern of the new variant of the virus that's come from the UK. Just when we thought we could breathe easy, literally and figuratively, I think there are some new concerns that have come up. But as Viren said, I think we really should not let our guard down. COVID is going to be with us. Vaccine, no vaccine, UK strain, Nigerian strain, South African strain. We have to be careful. That's the only way we can prevent the spread of COVID. And if we take those measures, I'm sure we'll be far, far better in the coming year. We have learned a lot in the last 10 years. We know how to handle pandemics of this size, how to allocate, reallocate beds and resources, and how to work with the government. And there's been a huge boost to technology, which is one of the greatest things that's happened in the COVID era. So we are a lot better prepared. And fortunately for us, the new strain may be more infectious, but not more dangerous. So if the civil society takes care, we can get over this virus.
Yes, you're right in pointing out that the new strain, the UK mutant, is more severe in terms of transmissibility, but even those are model-based studies, not lab-based studies. But the severity of the disease, so far, at least no indications that the situation could be worse. But Abhay, let me ask you, because, in Delhi, we saw, on account of measures by the government as well as the courts, a significant amount of restrictions being put in place on hospital infrastructure. Have those started to be reviewed? Have you heard from the government? What is the situation?
Yes, so I think, Delhi, unfortunately, has had pretty much 3 waves, unlike most other cities, where you had a wave and you had half a wave. But Delhi really has been 3 waves since the beginning of the year. Both the government and the private sector have had to collaborate, have had to be very nimble, set aside quite a few beds for COVID. Unfortunately, or fortunately, it depends on which way you look at it, we got into a situation now where the amount of capacity utilized in the COVID section is about 20 or 30%. That means 70% of the capacity which is earmarked is lying empty, while the non-COVID capacity is at about 100% occupancy. But this is again a changing scenario. It happened about 15 to 20 days ago only. And we've been speaking to the government. There has been an internal note, and we've been notified to bring down the capacity from 80 to 60%, which was the ICU capacity, and hold and watch till this new trigger, or the final trigger of New Year's gets over by the 8th of January, and then they look at further winding down capacity. So I think the conversation is on, and they've been the governments have been very receptive because I think they don't only have to address the challenge of COVID, but also the scourge of non-COVID. So that responsibility isn't from the government.
Well, so that's the good news, that occupancy on the COVID side has come down. Non-COVID occupancy has picked up. A review is currently underway, and perhaps post-New Year, we could see some of those additional restrictions that were imposed on catering to COVID occupancies being reviewed. But I want to pick up on something that Dr. Balal spoke of since we're talking about the road ahead. Viren, one of the big trends that we saw emerge, a forced trend, so to speak, on account of the pandemic and the restrictions and constraints because of the pandemic, was digital consults, and the way that has, in fact, seen an exponential growth. CLSA says 50 million Indians access digital consults between March and May alone. So is now this going to be the big pivot that hospital providers like yourselves gear up for in 2021 and beyond?
Yeah. The thing about pandemics and situation of this is that it changes a lot of behavior. Now, teleconsultation itself is not new. I think teleconsultation has been around for 100 years. As long as there's been a telephone that you can call the family physician, you have had access to teleconsultation. And even in our hospital, we used to conduct these over Skype and video conferencing. But the big difference now is that people are willing to pay for it. Consultations done over video earlier were inefficient, the bandwidth was poor, and the same is true today as well. The advantage, though, is that you don't have to go to a hospital, you don't have to fight for parking, and you don't need to waste time in the registration desk. And now it's seen as an equivalent, if not a superior option. And so definitely this is something hospitals of all shapes and sizes are taking up with great gusto, because consumers have finally come around to the fact that a lot of this work can be done online.
Yes. What will that shift mean, and this acceptance on the part of the end consumer mean, Dr. Balal, for businesses and for service providers like yourself? What will it mean both on the cost side as well as the expansion side as we move ahead?
I think the good news is that almost all the large healthcare chains have come to almost pre-COVID levels. There's a drastic reduction in the COVID patients, almost 80% in our group of hospitals. So what has changed now is, of course, one is digital health has come in a big way. The second thing is, I think, public-private partnerships, how to work with the government in case of pandemics has changed. Our business dynamics for the future will continue as before. We will look at more opportunities. If the opportunity is right, we will certainly go ahead and expand. And we will have a combination of hospitals that can take care of both pandemics and non-communicable diseases, including non-COVID infections. So I think it will be a combination of both. There will be heavy emphasis and investments in digital health, which I think most healthcare chains are looking at. And I think this is something that everyone should look at, because a lot of things that were done in the past by a physical visit really do not need to happen. Just to give you a quick example, the other day I had a teleconsult with an elderly gentleman in one of the remotest parts of India. It would have probably taken him 3 days to come to Bangalore. And when I talked to him, he was on a charpoy, and his granddaughters had a laptop. She connected me to him. And you would believe it or not, he was sitting outside a cowshed in the remotest part of India, and he was able to have a consult with me because of technology. And that is the kind of technology we look at, and that is the one that will overcome the rural famine of healthcare connectivity.
Well, that's certainly good news if we do end that rural famine of healthcare services, as you spoke of. But Abhay, sorry, let me ask you, Dr. Balal was talking about significant investments in upping capability, enhancing capability to provide digital healthcare services. What else could we see in terms of ancillary services that providers like you will focus on? I mean, Max at Home, for instance, home health services on the diagnostic sides. What else do you believe are likely to be the trends in 2021 and beyond?
So I think clearly, like you pointed out, home care is one. We do provide, it's a business which has been around for the last 5 years and has been growing at a fairly fast pace. But really, the pandemic has caused it to change its orbit entirely. And that's a business we will be doubling down on as well, because that's become a requirement, it's become a need. Not only people are seeking healthcare through and these are really OPD consults through telemedicine, but also physical interaction with whether it's ICUs at home or physiotherapy at home or whatever else you may call it. We have been able to do it through home care. And, that's a vertical we will be propelling forward as well. Of course, laboratory services have always been there. Most people, at least at present, prefer not coming to hospitals because, everything's said and done. There is still some fear of congested spaces in hospitals and so on. I think what will be very interesting to see is how much of this will sustain because although, this was a little bit need-based, consult had moved up, but, it's been plateauing in a lot of places, so, will this sustain teleconsults or people will get back to their old original habits once the entire fear of COVID dies down is something yet to be seen.
Yes, that is something that we're seeing across different sectors as well. But Viren, 2021, as you look ahead in terms of expansion, in terms of fundraising, in terms of additional changes, in light of the lessons learned, what should we expect from you?
There are things that I can disclose and can't disclose. This definitely has been a challenging time. It is events like these that definitely drive consolidation among healthcare providers, and you can expect to see some. When I'm speaking generally, for us at least, we've spent a lot of money on digital transformation, and we will continue to do so. And that has the effect of improving a lot of the efficiencies in the hospital, as well as improving the performance of the manpower that we have. So we're able to do more with less. But yeah, this has definitely been a wake-up call for all of us, and it's become very clear that there are a lot of strategic dependencies for hospitals, such as our dependence on international patients that we can no longer rely on. And so going forward, we have to either look at visiting, being where they are, or looking at the business that is more local to the hospitals that we have.
Yes, that wake-up call, it certainly has been for many. But Viren, you said you're talking about consolidation in a general sense, but could it be something that you would look at in a specific sense as well?
Yes, we would definitely. We have been looking at it for many years, and we'll continue to do so.
Okay, I would imagine that this is part of the I can't disclose much question or caveat that you threw my way. But Dr. Balal, wake-up call, as Viren pointed out, but also strategically more consolidation likely for you?
I'll probably talk to Viren after this in private to know what is it that he cannot disclose. Be as it may, for the Manipal Group, what I can disclose is that we have acquired Columbia Asia, and that is public knowledge. There are many other opportunities we are looking at, and it's too premature for us to say which way it will go. But what we have realized is that in spite of a severe drop in the revenues in the first few months, we are proud that we have not retrenched any personnel from our organization, and we have paid the full salaries for all our healthcare workers and bonuses for people who are in the front line. So I think that is one aspect I would like to highlight, that most of us, in spite of taking a severe hit, have managed to manage our people well. And I think that is a message to be taken home, that in spite of adversities, we can still manage the situation as long as there is a silver lining at the end of the cloud.
Oh, absolutely. Kudos to healthcare workers across the country, both within the private sector and the public healthcare system, for putting up, month after month after month, dealing with this pandemic. Abhay, so I'll give you the final say then. Dr. Balal is calling Viren post this program. Are you making calls to anybody as well?
We've been making calls throughout the pandemic, in fact. This has been a very interesting, exciting year. More than a wake-up call, it's really been about everybody pushing the envelope. And it's very interesting, in the same financial year, we've seen the biggest historical trough, in our business, and we've seen the historical peak in our business as well, almost back-to-back quarters. So it's very, very interesting. And, through the pandemic, we believe we've been able to manage it quite well, both our balance sheet as well as our operations. And, we were making calls throughout the pandemic. So hopefully, fingers crossed, soon something to speak about.
Yes. Yes, fingers crossed. Gentlemen, appreciate you joining us here on CNBC TV 18, not just today, but through the course of the last 9 months to talk about how this pandemic has shaped and changed our lives as well as the healthcare business. Abhay Soy, Viren Shetty, Dr. Balal, thank you very much. Appreciate your time, and we wish you the very best of luck for 2021. We'll wrap things up here on this special edition of Restarting India. Stay tuned to CNBC TV 18. The news will continue.